Breastfeeding is a natural choice. It is a natural habit, and it's part of infant feeding. Yet our statistics in South Africa, but actually worldwide, has shown that infants are not being breastfed anymore. And part of the reasons, there are a number of reasons for that, but it has very serious implications for the health of children. Infant mortality, that rates that's going up. So this is an international movement from World Health Organization, UNICEF, a number of non-governmental organizations and governments to put breastfeeding, which is actually the primary feeding option for infants, to put that back on the map.
Okay, thank you. So how is UWC connected with all these organizations?
At UWC, we teach dietetics students, and of course, nutrition is the business of dietetics. So as such, we're involved in nutrition, and we then formed this partnership with the provincial government officials, provincial government of health, and specifically the nutrition directorate, and hosted the seminar collectively.
Oh.
This was the whole theme and how we had put together the
Yes.
seminar. There's been quite a number of international documents on that's useful. There was the World Health Organization with a declaration in 2010 on infant and young child feeding. Then there's a couple of scientific publications, the Lancet series of 2005 first, then 2007, there's a 2008, and now a new one, 2013, focusing on nutrition and the impact of nutrition on health, development, growth, well-being, achievement of Millennium Development Goals, all of that. So as part of that, we felt that we need to package that scientific information as the evidence and summarize that for participants again, so that they have sort of just a good understanding of this is why breastfeeding is so important and where we are going. And then we wanted to showcase how the South African government has translated those international initiatives into policy. And specific aspects of the policy we highlighted, and they included the Mother-Baby Friendly Initiative, the Kangaroo Mother Care, the Sunflower presentation, which was the Community Support one, which was the very last presentation on the agenda today, but also the milk banking, donor milk, where you use donor breast milk for infants of very low birth weight. So we wanted to showcase that, to say this is how this evidence has been translated into government policy, and then use this also as an opportunity for interinstitutional collaboration between us and Stellenbosch and UCT, where we all three universities offering dietetics training and doing nutrition research to bring that to the fore, because we have been doing work on breastfeeding, and there are scientific findings of local Western Cape evidence. So we wanted to showcase that as well. That's why we've got these three components in the seminar.
Okay.
The Tshwane Declaration is actually from that 2010 World Health Organization Declaration on Infant and Child Feeding. The recommendation was made that each country should decide whether they are a breastfeeding country or whether they are a formula feeding country. And they should then structure their policies according to that decision. South Africa and the South African government took the decision that it is part of our culture and our background to have breastfeeding as the norm for feeding infants. And the Tshwane Declaration is basically the statement of intent by the government that it would try and support the country and people in the country to make breastfeeding and the feeding option of choice, and to keep it the feeding option of choice. So that's what the whole Tshwane Declaration was about. They identified specific areas that needed work, like policies had to be updated, renewed, revisited. Some of support structures need to be developed. That was also part of the Tshwane Declaration, but the main intent of it was to make the statement that South Africa is a breastfeeding country. The very last presentation was about what support does women need, or do women need, in order to be able to breastfeed. And they need, and that's why we use this abbreviation of the sunflower, to represent the support that they, with the woman in the middle, and then the 5 leaves being governmental support and legislation that needs to go with there, the healthcare system, social networks and family support, workplace, very important, and community. Because a woman might want to breastfeed, but if she has to go back to work, she needs certain things to be put in place for her to continue breastfeeding. And the ideal for breastfeeding is that we do exclusive breastfeeding for the first 6 months and maintain that breastfeeding with additional complementary food till about 2 years of age. That's to give the child the best start in life.
Thank you for that.